Good afternoon, guys. Today we are learning how to insert a central line under ultrasound guidance and using a special set which is called Micropuncture needle kit or Micropuncture introducer set. The advantage of this set is it is very small, and if God forbid you are in the artery, you just pull it out. You don't need to leave it in place and call the surgeon for intervention. So let me show you first thing the components of this set. So there are basically three components in the micropuncture set. So these are number one, a small needle which is 21 gauge, a very delicate guide wire, and the introducer catheter. So what I will do now, I will attach a syringe and I will identify my vein under ultrasound guidance, the vein which I want to cannulate, whatever it is, jugular or subclavian or femoral. And then under ultrasound guidance, I will go with this needle in. So I will keep going under ultrasound VN and aspirating. So once I am in the vein, I will get a flashback. Okay. Here I will stop aspirating. I will detach the syringe and I will introduce the guide wire. Now that the guide wire is in, I will pull the needle out and leave the guide wire in place. Then I will use this catheter over the guide wire. Bear with me. Due to old age, I can't see properly. Okay. So take control of the guide wire and go in all the way. Okay. Then unlock from here and pull everything out, including the guide wire. And immediately place your thumb because blood will come out and air can go in. So to prevent that, place your thumb. Now you can apply a stopper here and leave it in place. And then is the time to confirm whether you are in the vein or in the artery. There are two ways you can confirm. One is to attach this thing with a transducer and look at the pressure, venous pressure, and the waveform. So if you are in the vein, you will find pressure of like 5, 10, 20, sometimes even up to 25 if the central venous pressure is too high. And if you are in the artery, according to the blood pressure, you will see 80, 100, whatever is the blood pressure of the patient. And you will see the typical arterial waveform as well. And the second method is take a sample from this and send it for a blood gas analysis. This will tell you are in the vein or in the artery. Till you are sure and you're waiting for the blood gas, you can keep this thing closed. Okay. Now that you are sure that you are in the vein, not in the artery, now is the time to proceed with the regular guide wire. So here we are already in the vein. The catheter is already in the vein. It has accessed the vein. So we will skip this first step of going with the needle and puncturing the vein again. So no need for that. We have already done that. The next step is to put the regular guide wire. So open this and thread your guide wire through this catheter. This is your guide wire of the regular central venous catheter kit. Okay, so you are inside. Now you remove this catheter and leave the wire in. Okay. Now is the time for you to dilate. Where is my dilator? Dilate as you do normally. So again, take control of the guide wire and go in rotating movement almost halfway, and then take this dilator out, leave the guide wire in. Now you are ready to thread your catheter, 3 lumen or 4 lumen or double lumen, whatever it is, over this guide wire. So take the guide wire out till it comes out of the brown port, and then taking control of the wire, you go inside and then remove the guide wire, and you are in the vessel, in the vein. So this is how you cannulate the central veins using a micropuncture set. As I said earlier, if you are in the artery, not in the vein, you should not dilate, you should not put the regular catheter in. So this is how you can prevent arterial cannulation. Okay. Thank you for watching.